Thank you for being today in the podcast studio of Ignite in Central Virginia. Could you please tell us the full name of your company and what do you do?
The name of the company is Managed Senior Services, and we're a Medicare consulting firm. We actually help individuals who are approaching Medicare age, which is age 65. And most of those individuals are working. There's 65 million people on Medicare, and most of those individuals are working. So we do a lot of education, webinars for employers, individuals.
And where can the public find you? If they want to do a webinar, or what's the best phone number to reach you, or your website?
Well, our website is managedSeniorServices.com, MANAGED, Managed Senior, SENIOR, and Services.com. And so that's our website, and all the information is on there. Our local phone number, 804-440-9090. So anybody can reach us.
Perfect.
Simple.
And you are also an accredited business, so the customer can also find you at bbb.org.
That's right.
Now, you mentioned that a lot of people that is reaching the 65, they are working. Can you expand a little bit more on that? If you are working and you get into 65, when you are 64 and a half, do you need to reach to you, or how soon can we do it?
We recommend reaching out to us 90 days before your 65th birthday, but most of the individuals working have no clue that they may continue to work and come off the employer group health plan for what's available through Medicare. So that's been a big part of what we do. We help a lot of employers by doing these webinars because it's a win-win situation. You know, if they come off the plan at work, the employer does not have to contribute.
Exactly.
You know, and the employee could have more comprehensive coverage through Medicare. So the educational process is crucial for these individuals.
Okay. And for example, it seems like every year they change it. Is that true?
Well, every year Medicare plans change. Every year Medicare plans change. And so what we do is we research all of people's medications and the doctors and everything and make sure that their plan still fits their needs the best. Because, you know, a prescription may drop off of formulary. You may have a drug plan now that's working this year, but next year the levels go up, the prices go up, deductibles go up, and you know maybe other plans don't. So we research that every year for our clients, and that's the annual enrollment period Medicare. What Rob's addressing, you can do anytime if you're working and you're turning 65. Then we help you with that too. We compare what Medicare has to offer to what your employer has to offer, and see which one is more beneficial and cost-saving to you.
Perfect. And if someone doesn't speak English, do you have like a language line or something that can help them too?
We actually have not moved to that level yet. It's something that we have talked about. We really haven't had that many people to reach out to us.
Okay.
Yeah.
Who needed that.
With a different language. Okay. But do you speak any other language besides English?
No, not really. Just enough to get in trouble. No. I know a little bit of Spanish now.
Okay. Good. But usually the people get advice with someone else that also speaks English and will be like a teamwork.
Yeah,
I imagine.
exactly.
Yeah. Can you tell us what is the most important thing to know about Medicare in general?
I would say education, because people just don't know. There's so much confusion out there with all the phone calls that people are getting, with all the TV commercials, asking, do you have enough Medicare? Do you have the right Medicare? So it's very, very, and it's almost like they make it confusing on purpose. So you call, so you feel obligated to make the phone call. And then before you know it, you may or may not be on a plan that you don't want, that doesn't fit your needs. So that's why the education piece is so important, and that's what we focus on. It's just a whole lot of options out there, and we focus on what suits your needs the best. We contract with most all of the carriers, all the insurance companies, not all of them, but most all of them, and so whatever plan you choose, that's we represent that plan, and we'll help you get enrolled in that plan after we've explained it all to you, obviously.
Yeah. I have noticed from other friends that when it's enrollment time, it's like hard to reach the person. Do you try to reach a customer before enrollment time to make sure they're going to be fine?
Sure. That's one of our mainstays. We reach out to all of our clients and any other family members that they deem who need to know what's happening as well. So around August, September, we reach out to them. There is a document that CMS, which is the arm of the government that runs Medicare, they require individuals to sign first because of all the fraud that's going on. So we get that document out to individuals, and then we've created a second page in which they will provide us with the names of their medications, their doctors, so we have that information to research for them.
Okay. I also had seen on TV and things like that online that they say, you qualify for $600 or something like that. Have you noticed that? Is that like a scam or is that true?
We don't recommend that people call into the 1-800 numbers that they see on the infomercials. There's been a lot of fraudulent activity. Unfortunately, we have had clients who have contacted these numbers, and they were enrolled in plans that they really didn't understand that they were being enrolled in.
Wow.
And they're locked in to the plans once they do that because they're past the enrollment period that they have to make the changes. So it can be a drastic situation for many.
So if one of your clients already have you, they see something like that, the one they need to call is you to say, do you know if I qualify for this also, right? That will be the right way to do it?
Yeah, absolutely. And we know right off, we know if they can qualify for anything else or if it's not a scam, but it's misleading. A lot of the information is kind of misleading because what's available in one county may not be available in another county. What's available in Henrico County may not be available in Amelia County, for instance. So somebody sees that commercial and they call them, and it doesn't fit for them. And they may have Medicare and Medicaid. There's a whole lot of levels to it. Mm-hmm. But if you just have Medicare A and B, we've already researched everything for all of our clients. So, but yeah, if there's any confusion, we tell people to call us. Perfect. Call us and we'll let you know. I mean, what's going on with all that.
Exactly. You're looking out for them.
Absolutely. We touch our people all throughout the year. I mean, obviously that's how we make money. I mean, we want to make sure that they're okay, and we try to service our clients the best we can. I'm proud of the way what we do, and we take care of them. And if there's any issues, they know they can pick up the phone and call us.
Yeah, that's the most important thing, to have someone to trust. You even have an office that they can stop by if they feel more comfortable, right?
Oh, yeah. People just drop by unannounced sometimes. And that's okay, too. But I mean, we've had clients since 2010, 2011, dating back that far. So, yeah, still going strong.
Good. And when is your next seminar? Do you have it scheduled already, or is too soon in the year?
I have a webinar that I'll be doing for an employer.
Oh, for employer.
Yeah, that's pretty big. So we do these webinars nationwide for employers. So we are in different states throughout the United States. So if you have a relative who lives in a different state, we can help you. It really doesn't matter. But we're doing a lot of webinars for employers that has really taken off because, as I mentioned earlier, most of the individuals who are turning 65 are working. And they don't realize, nor do the employers, many employers understand the ramifications behind someone being Medicare eligible while working. So we do a lot of educational webinars for human resource HR directors.
Okay. And do you know from the top of your head the states that you manage?
Sure.
Can you mention them,
Sure.
please?
Of course, Virginia, West Virginia, North Carolina, South Carolina, Georgia, did I mention North Carolina?
Out
Florida.
west too, Texas, Nevada,
Oh, wow.
Mississippi.
Well, we have 50 states.
All over,
Maybe. Okay, so.
Because, people have friends and family, and we used to reach out to them and help them anyway and just kind of, give them guidance and tell them what to do. And we figured, well, we might as well get, do the license, whatever's necessary to get licensed in North Carolina, too, so we can, but we just help people. We just want to help people.
Wow, that's a very good statement. You just want to help people, all in general, the business and the individuals.
Absolutely.
As you say at the beginning, it's a win-win situation.
We've actually been able to help some primary care physicians as well.
Really?
Yes, so we reach out to primary care physicians because many of the people on Medicare have primary care physicians and they have Medicare. They don't have a Medicare health plan where there may be no copayment. So when you have original Medicare only, you've got deductibles to pay, out-of-pocket costs. So some individuals will not go to the doctor because of what they have to pay out of pocket. So we reach out to the primary care physicians to let them know that there are options for their patients wherein they're not required to pay anything when they come in to see them. So we educate them so that we can then educate their patients on what they have access to.
And sometimes when some of these people are enrolled by, whether it's fraud or whatever, but they didn't know that they enrolled in another plan. Some of the Medicare plans are network driven. You have, they're HMOs. They have networks, some of them, and they go to see their doctor, and maybe their doctor may not take the new plan that they're on, and they didn't even know they changed. So we work with doctors' offices, physicians' offices like that too. They'll call us and help them get their patient back, so they can start seeing their patient again. So we help physicians' offices that way as well.
Wow, I'm very impressed. Thank you for everything you do. And thank you also for being accredited by the Better Business Bureau so the customer can find you there.
Yeah, we can. And we're a family business. My wife and my son, if you remember, works with us, and then Rob and his son works with us. So it's just
really?
So the five of us,
nice.
It's just family. So it's we do a lot of work. We get it done, and we all feel the same way about what we do, helping people.
Wonderful. Could you please say one more time the name of your company? Managed
Senior Services.
Thank you very much for coming, and thank you for everything you do for all the population. Oh, our pleasure. Have a great afternoon.
Thank you. Same to you.